Hi, welcome to Mental Health Matters. I'm Shannon Eliot. Today we'll be discussing the role of trauma in mental health. Gena Castro Rodriguez is a licensed marriage and family therapist and specializes in providing therapy to victims of trauma. She is also the co-founder of the Youth Justice Institute, a nonprofit agency in the Bay Area serving youth in the juvenile justice system. Gena has written numerous articles in the areas of sexual identity and exploitation of young women. Nicole Plata is the Youth Initiatives Coordinator for the Mental Health Association of San Francisco. She has overcome a variety of challenges in her youth, from abuse and street violence to involvement in the criminal justice system and a traumatic brain injury. A native of East San Jose, Nicole uses her experience with trauma to advocate for California youth. Welcome, Gena, and welcome, Nicole. Thank you for joining me today.
Thank you.
Gena, how do you define trauma and how prevalent is it?
So one of the ways we think about trauma is that it's when external events overwhelm a person and their ability to cope, and that you have these long-term effects from it. So there's lasting effects of the trauma. And it's actually quite prevalent. The American Psychological Association says that about 2/3 of kids by the time they reach 16 will have experienced some type of trauma.
So to what degree is trauma a cause of mental health issues?
I think that it's probably more than we know. There are a lot of symptoms that you experience with trauma because it's very pervasive that mask or look like other mental health issues, behavior issues, learning issues. So I think if we get better about assessing and understanding what's happened for young people, we can get better about linking the trauma to the behaviors that we see and really identifying what triggered or began those behaviors for them.
And maybe what are some behaviors that you would see, and how does trauma influence emotions?
So it influences your cognitive abilities, your emotions, your relationship, your learning. It's very pervasive. So for young kids after an immediate trauma, we see some behaviors that can look fearful. They can have sleep disturbances, physical symptoms. They can start to avoid situations or develop new fears. And then later, it actually affects the way they relate with other people and the way that they kind of walk around in the world and the way they engage. So you have a trauma, and then there's the effects of the trauma, which are the things that kind of happen to you, the symptoms that happen to your body and to your mind. And then the reaction is the way that the kids learn to adapt to the trauma and the side effects and the different things that they experience. And then they relate to the world differently.
So Nicole, I understand that you've had quite a bit of personal experience with trauma, particularly abuse. What kinds of physical, mental, and sexual abuse did you face as a kid?
Well, there was just times where, like, I had, there was some abuse in the family at home, and physical abuse. I mean, there was a few times that certain family members tried to rip out my hair. You know, I was physically hit, and I was intimidated and told not to talk about it, or that, you know, and it was funny because a lot of times it happened in reaction to something I did emotionally. It wasn't actually like it wasn't like I was doing something wrong. It was being like corrected in some way. It was, you know, a family member felt hurt by something I did, and so emotionally reacted through, you know, physical violence. And I had also some like molestation that happened when I was younger through just within the family as well, and also with just different relationships I had at school that were abusive.
Yeah, I remember when we were chatting earlier, you mentioned some stuff at school, particularly something that happened on your birthday. Tell me about that.
Well, there was this, like, at school was, well, just in general, school was very rough because the neighborhood I grew up in, there was a lot of this looming threat of, like, violence. I mean, if you didn't personally see a gang fight, or you didn't personally see the shooting, you heard about it all the time. You heard about people getting shanked. You heard about so-and-so getting jumped. You know, you heard about knowing friends who passed away. And so, from gang violence. And so that was always there. And I don't know, we just always had this negative it was really intense. So, and we just interacted with each other in an intense way. And I remember it was a habit on people's birthdays to go and to actually like hit them. And not like, like on typical birthday, there's this tradition that you get like a spanking for one for every birthday. Like what?
Playfully.
Exactly. But but at school, it was like, no, you basically get jumped for your birthday. And I remember on my 13th birthday, I was surrounded probably by about, I don't know, like 20 to 30 kids. And basically they just punched me like over and over 13 times on my birthday. And I had like bruises up and down my arms, coming home. And I thought it was normal. I thought that was, because that's what everybody did. But actually mine was a little bit more, like other people that got slapped, and I actually was like punched. And
Yours was a little more intense than everyone
yeah, it
else's.
was really intense.
Yeah.
It was very surprising to have like, they basically came up, they gave me a hug, and they pulled back, and they all started wailing on me.
Wow.
Yeah, that was 7th grade.
So how did you deal with that in the moment, and how does that affect you to this day?
There were, in the moment, I think I thought it was normal. I thought that's what friendships were. These were young people I felt obligated to feel cool or like look tough around in order to feel safe. Especially what was going on in my environment at that time. I didn't really have family at home. By that time, one of my closest sibling was incarcerated, and my mom had separated from my stepdad, who was like my like safety. He was like the person that was always there. My mom worked long hours, and I was home alone. So these were the kids that, I found. I was looking for like love, looking for safety, and so I think it's definitely been a challenge learning how to redefine my boundaries in relationships, like what is appropriate in relationships of interacting with people, and then also too, what's been a challenge is identifying like how to express my needs and how I feel, because often I'm often very confused with what's okay, especially in that situation. That was what was socially accepted, and a lot of times and also anytime I expressed a need, like, ow, that hurt, like that wasn't cool, then I was putting my safety in jeopardy. And so there's a lot of intensity around being vulnerable and saying, like, I actually need this from you, because that would make me look weak, because I was supposed to be able to take it. I think that's what I walked away with. Like, I'm supposed to be able to take it. Like, I walked away feeling like, I didn't cry because it hit me. I didn't, I walked around. I felt some shame because I had the bruises on my arms, but but it was almost like this. I had to, I don't know. So I have a hard time, and I think in my relationship sometimes it'd be difficult admitting when I have needs or I have feelings that are negative, or where I can feel confused whether or not it's appropriate to express.
Sure, especially if you didn't feel safe being beat up, but then you didn't feel safe saying stop it. So it's like, what other options you have in a sense? Yeah. Gena, how does trauma in youth compare to trauma in adults?
So Nicole's story is really kind of a powerful example of what happens to young people who experience trauma. And there's something called developmental trauma, which is trauma that happens in a developing child. So early in childhood, usually in the caregiving relationship. And what happens is when the people that in your life that were supposed to keep you safe and were supposed to take care of you and meet your needs and provide for you don't, for a variety of reasons, because they can't, or because they are disturbed themselves, or because they're not able to provide those things, your attachment and the way you see the world changes. The way you see relationships, the way you see the world changes. So for a lot of kids who experience physical abuse or sexual abuse or neglect in the family, they start to learn these really important messages about safety and about who keeps them safe and about where they need to get the love and attention they need to survive, where they need to go to get that. And unfortunately, when you don't get it in your caregiving system, you have to reach outside of the caregiving system, and it puts these kids at great risk for being exploited or abused further outside of the family. And like Nicole talked about, you know, things get normalized because if in your family abuse or pain or neglect become normalized and the way that you start to see the world, then when you go out into the world, that's what you experience, and you do see it as normal, you do see it as okay or acceptable. Kids who get the attention that they need know right away when it's not right and when it shouldn't happen to them. So unfortunately, the childhood experiences and then sort of how those broaden outside of the home change the way you walk around in the world. And I think Nicole really spoke to that it can be then confusing to know what's okay for me and what's not okay for me, and what do I allow people to do in order to have them in my life, and what do I not allow to happen. And we do see a lot of kids that have childhood trauma or early in their development then seem to be at risk for ongoing trauma. They seem to get into relationships where they're further abused or further victimized, or they are in friendships that may take advantage of them or exploit them. And a lot of that comes from not having that sense of security and safety in the beginning.
Gena, what types of trauma are there, and what are some potentially traumatic events?
So there are interpersonal traumas, and those are the things that happen to us and happen in relationships. And then there are these external traumas, and we can both be affected by them and we can be affected by helping people who are experiencing them. So interpersonal traumas are things like abuse, neglect, sexual abuse, domestic violence, not having your needs met, having something happen to you interpersonally, some kind of an assault. And then sort of the external things could be, you know, natural disasters or wars or even illness in the family. And those you may experience them yourself, but you also experience them by working with, living with, or being with people who experience them. So we're starting to expand the definition to also include people who work in trauma and are affected by the trauma that, you know, happens to the people that we work with.
Nicole, you've also experienced physical trauma from a brain tumor.
Yes.
How has that affected your mental health?
Oh man, that was definitely a new, that was definitely a new challenge that really was very similar but very different at the same time. I think with the tumor, just to give a little background, it was the size of my fist in my brainstem and also in my throat, and so because of that I have a paralyzed vocal cord. But I remember when I first got the diagnosis and I went to one of the surgeons, and you know, even just being 23 and walking into a neuro-oncology department and having to wait in the neuro-oncology department, it's like, what? Like cancer? 23? Like that freaked me out. And I remember just being in a constant state of panic, and I felt like a lot of like anger, like in my body, like I'm killing myself, like my body's killing me. And when I went to the doctor, the surgeon, he told me that there was a potential that I was at, because the tumor surrounded my carotid artery, so I was at risk for stroke. I was at risk for losing the ability to swallow and to speak, and they were talking about permanent excuse me, permanent feeding tubes being placed, like permanent tracheotomies, like, and I'm like, what? Like, basically losing ability to like have sensation in my mouth, so being like slobbering all the time. And so I remember being on the bus on my way home from work and being like in my mind cursing people out in my head, like that I see on the bus, because I'd be so mad because I feel like you're not even grateful you can breathe on your own, and you're not even grateful you can eat. And I mean, that was and just the waiting was really hard. I remember I'm pretty independent, but for a while I couldn't sleep without having someone like spend the night with me in my room. I never slept with a stuffed animal before. Since then, I can't sleep without a stuffed animal. you know, I had several panic attacks. Like where I just felt like I couldn't breathe, and I was going numb, and I was like, I feel like everything in me wanted to scream at the top of my lungs. And you know, I went to luckily I like one thing that's really helped me is reading my Bible and praying. And so I remember going to the beach and just there was so much and I couldn't even focus. I felt like I was in like this fog and this haze, and I felt like no time or space existed. And so I went to the beach over in Pacifica, and I screamed out on the top of my lungs, just everything I felt. I was crying and praying, just screaming out my like everything, like tears, like saliva, everything was coming out, like, and that really helped. But it's been a challenge, I think, after, I mean, I'm so grateful because I had a ton of support. I had a ridiculous amount of support. Like I had about like 50 of my family members and church family who prayed for me for 14 hours during the entire surgery, you know, and took care of me. And that definitely helped. But after it was really hard, especially when just the physical pain has led to a lot of anxiety. I now like have a lot of anxiety around flying and being in cars, which is really funny because I've flown every year of my life since I was like 8 months old. But now I start panicking because I never knew that much pain existed before. And I remember waking up from surgery thinking, wow, I feel like I just got hit by a train. I feel like I just got hit by a train. And then the doctor comes in and he goes, so Nicole, you did great, but just want to let you know that the pain you're feeling right now is equivalent to being hit by a bus with a semi-truck fall right behind it. And I remember thinking, oh, so being hit by the train is legit. Like this is a real.
You weren't making it up.
Yeah, exactly. And so at that point, I think at that point, like now when I get into to planes, I don't know, in cars, sometimes I'm afraid that of feeling that same physical pain again. Like I don't want to ever be back there. But yeah, I mean, and just also there's a lot of depression that came after with losing my voice because I don't sound the way I used to, and I don't, you know, I used to sing and I can't sing anymore, and even being able to yell sometimes is, you know, sometimes when I'm doing my work and I'm in certain areas, you know, they can be kind of sketchy neighborhoods, and I think, man, if I can't yell for help, like what, you know, or just interacting with my friends in the same way. Like I used to be a very loud person. I go and I have like my church is like a big important part of my life, and when I go to events where there's like hundreds of people, I can't engage with people like I used to because it's so loud in that environment, and so people don't hear me as much. Or even going out to dinner with a group of friends, they can't hear me. And so I have an iPad now and I write, and you know, and it's like kind of, but even having to do that, there's kind of like this shame and embarrassment and feeling like,
sure,
why I'm only 25 and I have to do this.
Gena, what are some short and long-term effects of trauma?
So short term, it really affects a child's behavior and how they feel in the world and how they start to interact with people. And I think Nicole has spoken to that a lot, that there's these certain way that they have to start adapting in order to either mediate some of the trauma or hide some of the trauma or try to survive the trauma. But then long term, unfortunately, there's lots of really pervasive symptoms that we see. So even physical health. There's lots of diseases that are tied to early childhood trauma, and the ACEs study really gave us a lot of information about this long-term research about the link between the number of incidences of trauma and then the correlation to health issues later on, including, you know, diabetes and obesity and heart disease and things like that. And then there's also, you know, I think pretty important is the relational changes that happen for young people. So when they experience trauma early in life, they have to learn some important lessons about how to handle that trauma. And those things don't play out as normal relationships later when they're older. So they either have to protect themselves and stay away from relationships, or they have to cling to relationships because they're trying to get what they didn't get before. And they often get themselves in these cycles where the abuse continues or repeats or goes on in their life. They have more of it. So it's a challenge for them.
It seems that the role of trauma is often overlooked when it comes to folks either acting out or having misbehaviors or harmful behaviors. Why do you think that is?
Right. I think it's kind of what Nicole said, that if it looks sad and depressed and you need help, people are more used to that kind of a symptom, and you can reach out, and things that make sense like illness, people reach out and help. But when it looks like anger or aggression or criminal behavior or delinquency or any of those things, we start punishing the behavior and not looking at where it comes from. So it's really common in the juvenile justice system for us to see kids exhibiting behavior that's not normal for their age and not ask where it comes from, but just punish the behavior. So kids that are doing things that are abnormal, like assaulting other people or being involved in really dangerous activities or hurting themselves with substances or with their activities, there's something behind that. There's something that's motivating that kind of non-normal behavior. But if we don't ask, then we're only treating the behavior that they're using to cope with it. We're not dealing with what drove it.
I also think that, at least it was true for my family, there's other traumas that occurred with my parents and also with, like, in general throughout my family. And I think what I see is there's this, like, uncomfortability, like they haven't had an opportunity to get the support they needed from their traumas. And I think when I don't know, I don't have any kids, but I'm assuming you see your kid going through something, it brings up your own stuff, and not being quite sure, not being taught how to appropriately deal with your own, just it can become easy. I mean, one of my parents, for example, I like my father, him and my biological father, him and I didn't grow up with him as much, but he came in and out of my life. And I remember when I was, he lived in a more wealthier side of town, and I lived in East Side, and he didn't grow up in that environment. So when he see me, he would say, cut that gang crap. Like, you're doing that gang crap, or you're acting like this, like those people. And he didn't understand because he wasn't from that context that where I was living in. And then also too, like, there's other traumas in the family that weren't being dealt with. And so I think it was easy to go, stop it, rather than have that conversation, because I don't think he was ever supported in that way to have that conversation as well. And I don't think that he intended to shut me down, but I think that's what can happen when you're a service provider or a parent or any caregiver role for young people, and there's those traumas that I think in general a lot of people feel that shame, that stigma, and the uncomfortability to deal with, and also that just the helplessness, like, like talking about I was abused, now what? What do I do with that?
So how does one recover from trauma? How treatable is it?
So it's important to know that there's different kinds of trauma because they need to be treated differently. So there's lots of short-term intervention kind of traumas that work well with single incident of trauma. So there are, cognitive therapies, and there's immersion therapies, and those tend to work best for people that have, pre-trauma safety and support and structure, and they had some internal coping that they can, pull for when they have the trauma. So those short-term treatment models work well in that situation. Where they don't work well is for a lot of kids that we see in child welfare or in delinquency or in communities that have violence, is that these kids have experienced early childhood trauma, developmental trauma, and then it becomes chronic and complex. So a lot of what Nicole has talked about, that it wasn't a single incident of trauma, it's actually the way that Nicole lived and had to experience both her home and her community, and then she even had the medical trauma later on. So those short-term interventions don't work very well for someone who has that kind of experience. And really what you're looking at is long-term, trying to change these pathological beliefs that have developed out of the trauma. So these beliefs about how the world is, about how the young person is, and about how they have to engage in the world. So some of those pathological beliefs end up being, the world is not a safe place, or people that love me aren't going to be there for me, or I'm the only person that can take care of myself and I can't rely on other people, or people that love you hurt you. All of those lead to putting kids in situations where they continue to get hurt. If you believe love can also be painful and abusive, then you get into relationships that can also be painful and abusive because that's your experience and that's the way that you see the world. So the treatment has to be about changing those beliefs and helping people to establish safety, to take back their power, to understand how they can speak for themselves and how to protect themselves. And anyone can have an impact in that way. So therapy, there's relational therapies, there's longer term talk therapies that really help sort of change these ideas that young people have developed. But mentors and teachers and service providers can all play a role in helping change the way young people walk around in the world by giving them a different experience. So by being safe, by being protective, by being interested, by worrying about them and helping them and supporting them, you help change the way the world is for them.
Well, Gena, thank you for sharing your expertise. And Nicole, thank you so much for sharing your story today. It was a pleasure.
Mm-hmm.
Best of luck to both of you.
Thank you.
For more information on trauma-informed care, visit SAMHSA's website for the National Center for Trauma-Informed Care at samhsa.gov/nctic. To learn more about Gena's upcoming trauma trainings, visit her website at castrorodriguez.com. The Trauma Center at the Justice Resource Institute offers education, research, events, publications, and other resources. Visit their website at traumacenter.org. Thank you so much for watching. We'll see you next time.